Prime Minister Narendra Modi Saturday announced that frontline workers, people with comorbidities, and those above the age of 60 years of age would be eligible for a booster dose of the COVID-19 vaccine from January 10. He also said that vaccination for children aged between 15 and 18 would begin from 3rd January. ICMR and Bharat-BioNTech's Covaxin has now been given emergency use authorization for children above 12 years of age. In his address to the nation on Saturday night, the PM said that the decision had been taken in consultation with scientific advisors. The decision comes amid rising demand for booster doses as emerging coronavirus variants such as Omicron drive fears of a fresh surge. Already, Delhi and Maharashtra are seeing a surge in COVID cases. Both have R values over 1 now. Several clusters in Karnataka have also emerged. Over 400 Omicron cases in India have been detected so far, with Health Ministry stating that the variant spreads 3 times faster than Delta. Several studies, including some by Indian government researchers, have indicated that the protection induced by vaccines wanes after a few months and that coronavirus variants such as Delta and Omicron reduce the vaccine's efficacy. Meanwhile, there were reports suggesting that healthcare workers had started taking booster doses of the vaccine on the sly amid fears of the spread of the new Omicron variant. However, at Health Ministry briefings, officials had insisted week after week that India would focus on vaccinating the entire population with 2 doses before introducing booster doses. Earlier this month, INSACOG, a network of genome sequencing labs monitoring variants in India, had said in its bulletin that those over 40, especially those at high risk of exposure, should receive booster shots. But within 2 days of that statement, the body took a U-turn and said that its earlier statement was not a recommendation or suggestion for booster dose in the National Immunization Program. Similarly, in an Indian Council of Medical Research study of the Covishield vaccine's efficacy, researchers recommended booster doses as they found antibody levels reduced for the Delta variant. Some experts who had formerly advocated against the use of booster doses have also changed their stance as the Omicron variant emerged. For example, Gautam Menon, professor of physics and biology at the Ashoka University in Sonipat, told ThePrint in an interview that earlier he would have said it was important to vaccinate the entire population of the country first before giving booster shots. However, with the emergence of Omicron, it makes sense for people at high risk to receive a booster dose on priority rather than waiting to vaccinate the entire population. Several studies by ICMR showed that the Delta variant reduces the efficacy of the vaccine, but researchers said antibody levels were still high enough to continue to protect people from severe COVID. While there is no data on the efficacy of a booster dose for Covaxin, several studies already support the use of a Covishield booster. In a study published in the Lancet journal, a team of researchers found that the protection offered by the Oxford-AstraZeneca COVID vaccine, marketed as Covishield in India, declines 3 months after receiving the second dose. The study suggested that booster programs are needed to help maintain protection from the severe disease in those vaccinated with Covishield. The study found that a decline in effectiveness began to appear at around 3 months when the risk of hospitalization and death was double that of 2 weeks after the second dose. After 5 months, the risk increased 5-fold compared to 2 weeks after the second dose. Meanwhile, researchers from the University of Oxford have found in laboratory studies that a booster dose of the Covishield vaccine can significantly increase the levels of antibodies against the Omicron variant. In the study, which is yet to be peer-reviewed, researchers found that the levels of neutralizing antibodies were higher in people who had taken a 3rd dose of Covishield than they were in individuals who had received 2 doses of the vaccine. These results support the use of third dose boosters as part of the national vaccine strategies, according to the researchers, especially to limit the spread of variants of concern, including Omicron. Additionally, a study published in The Lancet earlier this month found that a booster dose of as many as 6 COVID-19 vaccines is safe and elicits strong immune responses in fully vaccinated people. The study was conducted on people who were vaccinated with either the Covishield or the Pfizer-BioNTech jabs. This was the first randomized trial of boosters given after 2 doses of either vaccine. The study looked at safety, immune response, and side effects of 7 vaccines as boosters, which included Covishield, Pfizer-BioNTech, Novavax, Janssen, Moderna, Valneva, and CureVac. All the booster vaccines increase the immune response when administered after 2 doses of the Covishield vaccine. Among those who had received 2 doses of the Pfizer-BioNTech vaccine, only Covishield, Pfizer-BioNTech, Moderna, Novavax, Janssen, and CureVac induced an immune response. In India, the Christian Medical College, that is CMC Vellore, is currently carrying out a clinical trial to evaluate the efficacy of booster doses. This is Mohana Basu, special correspondent at ThePrint. If you like our work, do consider paying for a subscription to ThePrint. You can do so through the link in the description box below.